Let's talk about ectopic pregnancies. An ectopic pregnancy is a potentially life-threatening condition that occurs when a fertilized egg implants and develops outside the uterus, most commonly in the fallopian tubes. Ectopic means out of place. It is one of the obstetric emergencies and a cause of maternal mortality. It occurs in 1% of pregnancies. However, its incidence is higher when a client has had fertility treatment. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the uterus, typically in the fallopian tubes. In rare cases, it may implant in the ovary, the cervix, or the abdominal cavity. The main cause of an ectopic pregnancy is a blockage or damage in the fallopian tubes, which may prevent the fertilized egg from reaching the uterus. Certain risk factors will increase the risk of an individual developing an ectopic pregnancy, and they include a previous ectopic pregnancy, history of pelvic inflammatory disease, a history of pelvic surgery or tubal ligation, previous tubal surgery or reconstructive surgery, maternal age over 35, in vitro fertilization treatment, history of infertility or fertility treatment, and smoking. Ectopic pregnancies often present with symptoms similar to early pregnancy, but additional signs may indicate an ectopic pregnancy, and they include vaginal bleeding, which may be light or heavy. In some cases, the client has abdominal or pelvic pain, usually on one side. Some persons will complain of shoulder pains resulting from blood irritating their diaphragm. And when the blood loss is heavy, the client will complain of weakness, dizziness, or fainting attack. Painful urination or bladder movements if the bladder or rectum is involved or affected. It's important to note that some women with an ectopic pregnancy may have no symptoms at the initial stage. Prompt diagnosis of an ectopic pregnancy is crucial to prevent complications. Diagnostic methods include: number one is a pelvic examination. Here, the doctor may perform a physical examination to check for signs of tenderness, swelling, or abdominal masses in the pelvic region. Number two, a blood test measuring the level of the human coronary gonadotrophin or HCG can help detect or monitor the pregnancy. In ectopic pregnancy, HCG levels may rise more slowly than in a normal pregnancy. A transvaginal ultrasound scan is the most common method for diagnosing an ectopic pregnancy. It allows for visualization of the fallopian tubes and the location of the gestational sac. Treatment for ectopic pregnancy depends on several factors, including the size and the location of the pregnancy, the woman's overall health, and whether the fallopian tube has ruptured. Options may include medical management. In cases where the ectopic pregnancy is small and hasn't ruptured, a medication called methotrexate may be administered. Methotrexate stops the growth of the embryo and allows the body to absorb the pregnancy tissue over time. Surgery is also another option. If the ectopic pregnancy has caused the fallopian tubes to rupture, or it is too large to be treated with medication, surgery becomes necessary. The surgeon may decide to perform a laparoscopic procedure to remove the pregnancy, or in severe cases may need to remove the affected fallopian tubes. Ectopic pregnancy can lead to complications, and they include rupture of the fallopian tubes. In cases where the pregnancy is not detected on time and treated promptly, the fallopian tubes could rupture, causing severe bleeding requiring emergency surgery. In some cases, the chances of having a successful pregnancy in future may be reduced, particularly if the fallopian tube has been removed. However, many women go on to have healthy pregnancies following an ectopic pregnancy. Experiencing an ectopic pregnancy can be emotionally challenging for individuals and their partners. Feelings of guilt, sadness, grief, and anxiety are common. Seeking emotional support from loved ones, support groups, or counseling services can be beneficial in navigating these emotions. While ectopic pregnancies may not always be preventable, Certain measures can reduce the risk of ectopic pregnancy occurring, and they include practicing safe sex and using barrier methods of contraception, promptly treating and managing sexually transmitted infections, seeking early treatment for pelvic inflammatory disease, and considering fertility treatment options with a reproductive specialist. Ectopic pregnancy is a serious condition that requires prompt diagnosis and appropriate treatment. Early detection and intervention can help prevent complications and preserve future fertility. If you experience any concerning symptoms during early pregnancy, it's crucial to seek medical attention for timely evaluation and care.